According to Merriam-Webster, crowdsourcing is defined as obtaining ideas or services from a large group of online communities instead of traditional employers. I think that crowdsourcing will play out quite well in healthcare. Healthcare is a very interdisciplinary field, and ideas from different parties are being exchanged on a daily basis. A few important components of proper crowdsourcing are the quality of labeling and the learning model quality. These components will affect the strength and the precision of the algorithm. Ensuring the quality of labeling is challenging, however, as the study points out to biased labeling and spam, which can affect the reliability of the data. This is why it is important to evaluate multiple label sets using ground truth inference. Ground truth inference algorithms can also estimate other parameters to ensure quality, including the background knowledge of the labelers and the difficulty of examples.
Each algorithm has different label types, methodologies, and assumptions. Each algorithm is effective in different problems. For example, DS is considered to be a good theoretical model to analyze the error rate bounds of label regression. Some inferences are based on linear algebra and statistics such as Karger's inference. Labeling bias is one of the main research issues in learning from crowds. Platt solves this issue effectively and quickly by counting the number of positive labels of each and automatically searching a threshold to classify examples into categories. Since the label quality is the basis of a learning inference model, it is important to build and improve the performance of ground truth inferences. There are different methods of building the learning model from crowdsourced labeled data. For example, there are ordinary supervised learning, active learning, and transfer learning model. Ordinary supervised learning uses a logistic regression model or other formulas. Active learning requires a design for instance selection strategies and can be useful when there is not enough data available. I learned that there is no one good algorithm to solve all crowdsourced related issues.
Social media tags are significantly different from crowdsourcing labeled data. Social tags are used by consumers to engage other consumers or businesses to different liked items or themes. In contrast, crowdsourcing labeled data involves utilizing algorithms based on tangible economic gain for their users. As such, crowdsourcing can be a much cheaper method of gathering information into a database. Current crowdsourcing research relies on open algorithms to gather data such as BATC or Square. However, these systems are limited by its inability to gather different aspects of learning from crowdsourced data, whereas CEKA can. CEKA is an improved system because the structure of the system can be adapted as the algorithms improved and has a large number of ground truth inference algorithms to ensure that data is reliable.
It was recently found in a study from researchers at the University of Chicago Booth School of Business, the University of California, Berkeley, and Partners Healthcare in Boston that many algorithms are associated with healthcare that have been associated with healthcare have racial bias. The research showed how many high-risk healthcare management systems they accept more healthier white patients than they do black patients who aren't as healthy. And the reason for this bias is because the algorithm determines who gets into these programs by looking at the patient's healthcare costs to determine the patient's risk or who it feels might most likely gain the most benefit from this care management program. And I feel like this can be a huge problem for patients who aren't able to get the right assistance that they might need from these programs because of the racial bias. And it was actually shown that after the bias was corrected, that more than double of the patients were black patients that were admitted into the program.
The issue of algorithm bias in general is difficult to analyze due to the algorithms being designed by private companies. As previously mentioned, the situation and physiological health of those treated are biased towards those that have high risk. Researchers are still discovering ways to fix these algorithm biases and are training it to be more well-rounded. Bias itself is one of the reasons why not all people in all different types of communities can have access to healthcare due to not having the resources, opportunities, or money. I believe that rather than relying on these formulas to determine who is in the most need of care, it should be based on their physiological health or unavoidable treatment. Physicians should be able to determine how dire patients are in need of treatment rather than relying on algorithms to determine for itself.